Kate Baber, and I'm a Health Policy Analyst at the Washington State Healthcare Authority. And it's my pleasure to introduce our guest panelist, Ashley Mann McMillan from the Technical Assistance Collaborative. Before I hand it over to Ashley to begin the presentation, just a few logistical notes. One, we are recording this webinar and will send a recording and a copy of the slides to everyone who is registered after the webinar is over. So watch your inboxes for an email from the Healthcare Authority. We'll have everybody on mute during the webinar to maintain a good sound quality. If you have questions, please type them into the question box, and we'll be reviewing some questions for which we have time for after the webinar content is over. And if we don't get to your question, we'll follow up over email and make sure to answer it directly. With that, I'd like to introduce Ashley.
Great, thanks, Kate. All right, so hi everyone. Welcome to the webinar on coordinated entry and foundational community supports. So here's our agenda for today. We'll do a little bit of introducing and framing of concepts, and then we're going to move on to Coordinated Entry 101 so that foundational community support staff have a thorough understanding of the coordinated entry framework. Then we'll talk about ways on a client level FCS can help move people through a coordinated entry system. And then we'll discuss program and system level ways to collaborate with your local coordinated entry systems. We'll also have time for questions at the end, so please follow Kate's directions in terms of how to submit questions so we can get to those. All right, so for introductions, again, my name is Ashley Mann McClellan. I am from the Technical Assistance Collaborative, and I'll be your webinar presenter for today. We call ourselves TAC for short. And just to give you a little background, we're a nonprofit consulting firm, and we specialize in areas of affordable housing, housing for special populations, ending homelessness, and human services. One of my areas of work specifically is around helping communities build, maintain, and improve their coordinated entry systems. I also want to share a note about the intended audience for this webinar. So the content was built for foundational community support staff who might be interacting with coordinated entry systems throughout Washington State. The goal for today is so that FCS staff have the tools and ideas on how to further collaborate and integrate into local coordinated entry systems. As well, on the webinar, there may be coordinated entry leads or COC leads. And the idea there is to figure out ways that you could allow more integration of the FCS supports into your system as well. But you will hear some Coordinated Entry 101 that I'm sure you're familiar with as a Coordinated Entry or COC lead. So before we dive into the webinar content, I do want to cover some alphabet soup that you may see throughout the webinar presentation, just so we're all on the same page. So briefly, a COC is a continuum of care, and what a continuum of care is the general body, which is usually made up of providers, system administrators, consumers, and any other stakeholders in a defined geographic area who are working to end homelessness. So it's a really broad array of stakeholders working to end homelessness in a defined geographic area. Please note that a COC's defined geography may be different than how county lines are drawn, and typically a coordinated entry system uses a COC's geography, not necessarily a county geography, but sometimes they do use a county geography, but just to know that there might be differences there. Also, CE or CES stands for Coordinated Entry or Coordinated Entry System. FCS stands for Foundational Community Supports. PIT, PIT, stands for the annual point-in-time count of people experiencing homelessness in a COC. If you see PH at all in the presentation, it's just an abbreviation for permanent housing. And then we'll talk a little bit about system performance measures, SPMs, which is a key way that HUD measures success for COCs. All right, so now we'll go into Coordinated Entry 101, where we'll talk about what coordinated entry is and the HUD requirements you might be seeing in practice in your local coordinated entry systems. All right, so what is coordinated entry? It's a broad definition, and at its simplest, we would say it's the way a COC organizes access, assessment, prioritization, and referral into the permanent housing units it oversees. And this way, it's so that anyone experiencing literal homelessness in a COC's geography experiences the same access to these housing resources, regardless of what agencies they may be served by. It's important to recognize that coordinated entry was a big systems change from a program-centric model to a person-centric system. So what this means is that previously, programs that were funded by these HUD homeless dollars were the entities that decided how people accessed or were prioritized and referred into their own housing units. What that created was multiple silos that clients had to navigate between programs. So now with coordinated entry, the idea is that there's a centralized process that looks the same for everyone trying to navigate the system into these into these housing resources that are dedicated to people experiencing homelessness. I should say that while the process has to be standardized within a COC for coordinated entry, it does not have to be, oh, 1 second. Okay, it does not have to be standardized across COCs. So you may be interacting with different COCs that have very different approaches to how they've organized or designed their coordinated entry system. So here are some of the key components of any coordinated entry system that HUD requires. So in terms of access, coordinated entry systems should be accessible to people no matter where or how they present in a COC's defined geography. Assessment processes should be uniform. So HUD does allow some variation between some populations. So you may see one COC use multiple assessments where that's allowed. One example is that all youth entering coordinated entry may have a different assessment process than adults. But even within those populations, the assessment has to be standardized. Prioritization of resources also has to be uniform throughout the coordinated entry system so that all entities in the system are using the same uniform decision-making processes, and clients are not preferenced for resources based on a staff person's knowledge or what programs they may be affiliated with. Also, HUD pushes communities to prioritize the most vulnerable for all of its housing resources to the extent possible. So keep in mind, HUD gives guidance on defining what vulnerability means, but HUD does not actually prescribe what it means, and HUD urges communities to use local factors to determine who is most vulnerable. Also, referrals to housing matches also have to be standardized, and so what that includes are things like policies for coordinated entry systems to screen people in as much as possible so that referrals are successful for the most vulnerable populations. So here are graphics that you may have seen in the past at different presentations about coordinated entry. The one on the left is a system before coordinated entry was built. So you'll see it's in the shape of a maze. It's very first come, first serve, and it's for those who are able to navigate the maze often on their own. That's who end up getting the house that's in the middle of the maze. You'll see the dots, they represent people, and some have question marks, some have exclamation marks, because there's no uniform way to access the housing resources. They all make it based on finding their way through the maze. On the right is the graphic post-coordinated entry. So you'll see the process of getting to housing resources is no longer a maze or a first come, first serve process, but it's based on uniform processes that a COC has designed. Here's another sample visual just to help people wrap their minds around what coordinated entry is. So this is just a sample. A local coordinated entry system might look different in that they don't have all these parts or they've configured them differently. But here you'll see the system tries to prevent or divert people from entering homelessness before they get assessed for more permanent housing resources. And this is one way that people can travel through a coordinated entry system. So what's the purpose of coordinated entry? So according to HUD, these are some of the key reasons why they were looking to have communities design coordinated entry systems, and then why they ultimately mandated that they design these systems. So first, it's to prioritize those who are most in need for the very scarce housing resources that a COC oversees, rather than having a first-come, first-serve approach where those who may have less severe service needs are being paired with very intensive housing interventions. It's also to have a person-centric system, as we've talked about previously. So HUD also cites that one of the benefits of coordinated entry is to systematically collect information about a COC's gaps, demands, and needs. And we are, in fact, seeing this across the country now that coordinated entry systems are more developed. COCs using their coordinated entry data are now more able to articulate gaps in their efforts towards ending homelessness. Ultimately, most COCs have established the goal of making homelessness rare, brief, and non-recurring. So some of the policy decisions you see reflected in your local coordinated entry systems may actually reflect how that COC intends to reach that goal. So also, providers, agencies, and programs that participate in coordinated entry cite some of these common benefits to having a coordinated entry system. So one of them is that there is clear transparency now on how to access housing resources. Prior to this, you would go program to program to figure out what resources your clients actually qualified for. Also, they report that administrative work is often deduplicated now that the process is centralized. And then they also report that the whole system is now caring for participants rather than individual programs. So in a lot of coordinated entry systems, you'll see case conferencing, you'll see stakeholders come together to figure out how to appropriately resource different clients. And so it's not just one program caring for clients, but it's the system at large now. To find the access points to your, or what's also commonly called the hubs to your local coordinated entry systems, we provided this link to a list of access points, and it's listed by county. And you'll get a copy of these slides, and this is recorded so that you'll have these links, because there are other links that follow in the presentation. So now we'll talk briefly about HUD requirements as related to coordinated entry. HUD requires all COCs to have a coordinated entry system developed with written policies and procedures, and the deadline for compliance was this past January in 2018. So we're going to talk about some of the key HUD requirements that you might be seeing in practice. The first key compliance point is looking at what housing resources actually have to receive their referrals from a coordinated entry system. So HUD mandates that certain types of housing resources must receive all referrals from coordinated entry systems, and they can no longer have what's considered side doors to entry, where they take some referrals from coordinated entry and then some referrals from other providers or from outside the system. So here you'll see it's permanent supportive housing, rapid rehousing, homelessness prevention. Those three resources have to receive their referrals from coordinated entry. It does depend on the funding sources for these three resources. So COC and ESG funding for these resources must participate in coordinated entry. We talked about COC, and that acronym ESG is the Emergency Solutions Grant. SSVF, the Supportive Services for Veteran Families program, must also receive their referrals from coordinated entry as well, although it might look different in each COC how that plays out due to how much SSVF they may have in their community. Some COCs who have robust local, city, or county, or even state funding for some of these same resources like permanent supportive housing or rapid rehousing, those local funders may also mandate their providers to participate in coordinated entry. So you might see some of that happening too. In some COCs, you may see domestic violence providers have an alternative coordinated entry process, or they might be integrated into the larger system. It's a choice that each community has. And then lastly, HUD gives the option of including emergency shelter and transitional housing beds in your coordinated entry system. So you might see this play out differently in each COC. In some COCs, emergency shelter and transitional housing beds are more on an emergency basis. And in some COCs, they've decided to actually prioritize who gets referrals into those beds as well. So here's a slide of the primary written policies and procedures a COC must have had completed by HUD's compliance deadline, which was, again, this past January. They speak to themes that we've already discussed around access, assessment, prioritization, and referral to those housing resources that I told you. You'll also see that a key aspect of coordinated entry compliance is having a uniform way of assessing people for those housing resources that they just spoke about. So like we said previously, you may see standard tools, but differences across 5 key populations. And this is an option that HUD gives. So the populations that might have differences in how they are assessed are youth, families, single adults, those fleeing domestic violence, and then those seeking homelessness prevention resources. So you might see different assessment tools between those 5 populations, or between some of them, but not all of them. Also, you might see different assessment tools or approaches being used at different points of someone's homeless episode. What this is called is phased assessment. And HUD encourages a phased assessment approach where you are assessing for the least amount of information at each point in someone's homeless episode to help someone exit as quickly as possible, but with them giving as little information as possible. And then HUD encourages that these assessments should build on each other so that people are answering as little questions or giving as little information as possible through each stage of the process. So if you would like to check out more information on HUD's coordinated entry requirements, you can visit the HUD Exchange website. There are resources, there are guidebooks, there is the coordinated entry notice that HUD put out, which outlines all the requirements that are mandated. Here you see a snapshot of the 30-page coordinated entry self-assessment worksheet. And this is a worksheet that COCs can use to actually check their progress on compliance with these HUD requirements. So I also want to briefly want to cover what HUD system performance measures are and how they relate to coordinated entry. So system performance measures are what HUD uses to evaluate the performance of how a COC is doing on ending homelessness. The set of 7 measures, so there are 7 HUD system performance measures, they look at how people travel through a whole COC system rather than just looking at the performance of individual programs that are funded. So it's a very person-centric way of measuring performance. So currently, the way that HUD uses these system performance measures is HUD compares COCs' performances on these 7 measures to how they did compared to their initial baseline and how they did in previous years. So basically, COCs are compared to themselves right now. These system performance measures are important because they are an important part of how COCs actually score in HUD's annual COC funding competition. And it's that competition that renews and brings in more housing resources for people experiencing homelessness in a community. And HUD has said or messaged that system performance measures and how COCs perform on them, that will become a bigger and bigger part of the annual scoring process each year. So they're very important. Here are the 7 system performance measures listed here, and together as a full picture, they measure how a COC is doing on ending homelessness. You'll see these 7 measures actually line up with the goal of making homelessness rare, brief, and non-recurring. So for example, the length of time someone spends homeless is a key measure, which speaks to the goal of trying to make any homelessness episode as brief as possible. You'll see system performance measure number 6 is currently grayed out. That's because it will only be for communities who have received approval to serve youth and families who meet other federal definitions of homelessness outside of HUD's definition. We don't have any of those communities yet unless they've been approved to pilot innovations to ending youth homelessness. So right now, most places are not using this measure. We do encourage you to look at these goals and try to draw parallels between FCS and its mission and what HUD is looking for COCs to do. So for example, FCS, it offers supported employment services, which can directly help a COC improve performance on measure number 4, which is income growth. You'll also probably notice that some of these measures baked into how your COC has decided to prioritize people for its scarce housing resources. So for example, if a goal is to reduce people's length of time homeless, some COCs are using length of time homeless as one of the factors that they use to prioritize who gets what housing assistance first. So here's a visual to put all of this together into more of a concept. The goal of a coordinated entry system is to help people move to permanent housing. And so overlaid on this visual are how the concepts of making homelessness rare, brief, and non-recurring interact with a system. So we often use a bathtub analogy when looking at a system to end homelessness. So essentially, if a system has succeeded in ending homelessness or making it rare, brief, and non-recurring, it has built the resources and capacity to lessen how much water actually comes into the bathtub, as well as to drain the bathtub of water that did come in so it never overflows or so that the water level never rises. So now that we've gone over the background of coordinated entry, we're going to dive into how foundational community supports can collaborate with coordinated entry systems on a client level. The services we're going to be talking about regarding collaboration are FCS Supportive Housing Services and FCS Supported Employment Services. So we'd like to review what supportive housing services and supported employment services can actually cover now that we've talked about the background of coordinated entry systems. So supportive housing services can cover activities that are essential to helping someone move through a coordinated entry system or to access housing resources or to maintain tenancies once people are housed. So examples of activities that can be covered include conducting housing assessments, identifying housing resources, helping someone obtain a lease, working on tenancy skills such as independent living skills, landlord relations, and crisis management. All these can be critical to help someone move through coordinated entry or to keep their tenancy once they are housed. Eligibility for supportive housing services includes being 18 years old or older, Medicaid eligible, having at least one health needs criteria, which could include a mental health, substance use disorder, or needing assistance with activities of daily living, or having another complex health need. There is a link. It's linked in the word eligibility at the top of the slide. That link is to the exact, very specific criteria. So this slide is a general paraphrase of the eligibility. Also, people must meet at least one risk factor, which may include meeting HUD's chronically homeless definition, having dependence on institutional care or adult residential care, having frequent turnover in caregivers, or scoring at least a 1.5 on the PRISM assessment. Keep in mind that these risk factors often overlap with how a COC has defined who their most vulnerable populations are for housing resources. So now we'll transition to talking about supported employment services. So these services may include assistance with benefits counseling, obtaining or maintaining a job, job-related discovery, planning for employment, negotiating with employers, and crisis management. On this slide, we also wanted to share some of the key principles that drive supported employment services so that partners on the webinar who might be coordinated entry staff or other COC staff who are not deeply involved with providing supported employment can think about ways to increase enrollment in your communities, which also could help with some of HUD's key system performance measures such as income growth, increasing placements to permanent housing, and reducing returns to homelessness. So for example, around these principles, these services have a benefits counseling aspect that many clients may be interested in accessing. Also, there's zero exclusion or screening out of participants based on their history of illness or substance use, making these services extremely low barrier. Here's the eligibility for supported employment services. So the pieces highlighted in red are highlighted in red to show you where there are differences between eligibility for supported employment and supportive housing services. Here you'll see that someone could access one service even if they don't qualify for the other. Eligibility for these services, supported employment services, include being 16 years or older, being Medicaid eligible, having at least one assessed health-based need, which may include evidence of a physical impairment to working, and having at least one risk factor. You'll see these look different than the supportive housing services risk factors. So before I go into concrete tips on how FCS can help people move through coordinated entry systems, I do want to remind the audience of some of these pieces of coordinated entry. So first reminder is that coordinated entry, it's a system configuration. It's not a program that HUD actually funded. HUD's mandate to have coordinated entry is actually an unfunded mandate, unless COCs pursued specific funding to run it. So there are federal dollars that can help run coordinated entry. There are local dollars that are being used, but that's only if a COC pursued it. There was not funding for everyone to actually do this. I say this so that everyone has an understanding of why you might see some coordinated entry systems with staffing to help people navigate housing options, and then some without that type of staffing. Keep in mind, some coordinated entry systems and the programs within it may have absolutely no housing navigation, no housing placement, no stabilization or employment benefit services that they can offer participants. Also, remember that the housing resources that participate in a coordinated entry system to receive referrals often have very few open slots per year. So we don't want people to think that completing a coordinated entry assessment automatically means the person is in queue and will actually receive a housing resource. In some coordinated entry systems, this could take years, or it could not happen at all if a coordinated entry's priority list is too long. We encourage FCS staff to assist clients to pursue all possible permanent housing outside of a coordinated entry system to help reduce the length of time that your clients are experiencing homelessness. Another reminder is that there's often great overlap between FCS's eligible population and the populations that a community has deemed most vulnerable for its coordinated entry system. So coordinating with these systems on how to serve this overlap can help COCs perform better with HUD system performance measures, which may help to bring in more precious housing funding into these communities. And lastly, the last reminder is that there is a lot of variation between COCs on how they decided to set up coordinated entry, which is allowed and encouraged. HUD wants these systems to really speak to local demands and conditions. So there might be ideas that I list here in terms of how you could collaborate with your coordinated entry system that might not actually work well in your COC's local configuration. I'm just giving you the tools to know the questions to ask or the places you might be able to insert yourself, but please defer to your COC or coordinated entry lead on how to actually make that happen. So now we're going to go into some of these tips of how you can use FCS to support people to move through a coordinated entry system. So one way FCS may be able to coordinate with coordinated entry systems is in the practice of diversion, or what's now being called sometimes rapid exit from homelessness. It's also being called problem solving, a way out of homelessness. The term is new and flexible and changing by the minute. Many COCs have what we call short flexible funds available to help people access or return to permanent housing destinations. And often these destinations for this type of work are roommate situations or family or friends, or returning back to another locality that they may have come from. The reason that this is emerging is because COCs and coordinated entry systems do not have a permanent housing slot for every person in need who's experiencing homelessness. So often what coordinated entry systems are now doing is they have scripts or problem-solving conversations that they have housing navigators use with clients to figure out what options might be possible. So definitely talk to your coordinated entry lead on what role might make sense for FCS to play here. Another way FCS staff can assist clients to move through coordinated entry is by helping clients to access the coordinated entry assessment process at various access points. So accessing the assessment process could include helping someone to physically arrive at an access point. It could include helping people to use a virtual or phone access point if that's available in the COC, or it could include actually becoming a trained, approved access point through your agency that conducts coordinated entry assessments so that your clients don't actually have to go to another access point. They can access the process through you. So talk to your coordinated entry lead to see what might be possible. It may or may not be possible depending on how the COC has configured access points and assessments. Some COCs have what's called a no wrong door model, which means they encourage many access points and assessors. Some COCs have a very specialized, limited assessment team that goes out and does assessments. So you'll have to talk with the local COC to see what might be possible here. FCS can also be a critical support during the navigation and housing match pieces that happen as people move through coordinated entry. So some ways that FCS staff can be a critical resource are you can become a contact for your clients that the coordinated administrator might use if the client is actually matched to a housing resource. So often, coordinated entry systems, they don't have the staffing to assign everyone a navigator to be the contact. And what often happens, and it's a big problem with many coordinated entry systems, is it results in a lot of lost housing matches where people are matched to a housing resource, but then they can't be found at the time that the resource is opened up. So that is one way that FCS could be a big help to coordinated entry systems. Also, FCS staff can play the role of outreaching to FCS eligible clients who are near the top of a coordinated entry queue or are in the coordinated entry priority pool. So remember, there's often great overlap between the FCS eligible population and who the coordinated entry system has determined is most vulnerable or a priority for the housing resources. It's also very important to gain a clear understanding from your coordinated entry system about who actually has a chance of being housed with a housing resource in coordinated entry and who does not. This is because the resources are so scarce that if your clients are not prioritized for a resource in the near term, it might be really critical to help them pursue permanent housing destinations that are outside of the scope of coordinated entry. Additionally, engaging clients, whether they are in the priority pool or not, in signing up for supported employment services can help to open up housing options outside of coordinated entry by having an increased income. Another way to help move people through coordinated entry is by assisting them to collect eligibility documentation that might be needed to either stay on the priority list or actually enter a housing program. So sometimes if a client is actually matched into a housing resource in coordinated entry, there's also housing search that needs to happen, especially if the unit is a mobile voucher or mobile rental assistance, but sometimes the programs don't actually have the staffing to conduct the housing search. So this is another way that FCS can help people move through the process. And then lastly, coordinated entry systems alone, they typically don't have access to stabilization services to help people maintain a tenancy. So some individual programs that clients might be referred to might have these services, but the system as a whole does not have access to these services. So FCS's ability to provide stabilization services or connect people to other stabilization to help gain housing stability once people are housed is very critical. Here are some frequently asked questions related to what we just talked about. So one question that comes up is, can FCS pay for outreach to people experiencing homelessness? And in a nutshell, the answer is only if the person is already FCS eligible and enrolled can you do the outreach to that person. Can an FCS participant transfer FCS providers? The answer is yes, and this is very important for coordinated entry planning and thinking about how to secure stabilization services for those clients that start the coordinated entry process in one area but actually are housed in another area. The last one is, how do people access FCS services? So please note that FCS, it's not an independent benefit, and it can be accessed regardless if someone is participating in a coordinated entry system or not. So on this slide, you'll see are the instructions on how to access the benefit, and then as well on the last slide of the presentation, you'll see links to resources on how to get someone set up with FCS. So now I'm going to move to tips on how FCS can collaborate with coordinated entry systems on a more systems level. So the first place is to look at where data matches may happen. So for example, with data sharing agreements in place, FCS and coordinated entry staff may be able to work together to really target staffing capacity to the shared population of a coordinated entry system's priority pool and those that are FCS eligible. This could help with locating those who are near the top of the queue for a housing match, or conducting assessments on the priority population, or collecting missing documentation to help someone get into a unit, or securing critical stabilization services for those most in need who may be moving to housing units where the services need to be more robust to be able to support that person's service needs. Sometimes figuring out data sharing can be daunting, as we all know. And so without knowing the specifics of each of your COCs or the FCS providers, what we encourage you to do, and what other places have done, is to meet with your coordinated entry leads and to figure out what pieces of data can most easily be shared between the two parties. Because often what we find are there are simple data sharing possibilities that can really further collaboration in a big way. Even if you decide that there's only one or two data elements that could be shared, sometimes that can help really increase coordination. Also, just one idea to put out there, we've seen some communities do what they call surge events between multiple systems, such as coordinated entry, FCS type providers, housing authorities, and benefits providers. And so in these situations, the surge efforts target the people at the very top of the coordinated entry queue, and they have those clients sign an interagency release between all the providers present at this surge event. And with those releases, clients are able to use this surge event, which is sometimes a half-day or a day-long event, as a one-stop shop event. And what they do is they enroll in benefits, they enroll in FCS type supports and make sure that their health plan is in the correct status to be able to enroll in FCS type supports. And then they move to the next step of getting a housing offer, all on the same day. One thing to know is that every COC has some sort of governance structure that supports how decisions are made within the COC about things like how coordinated entry runs, who's prioritized for assistance, how to improve system performance, all sorts of things. Check with your COC lead to see if there are committees you could join so that your knowledge of FCS can be integrated into how the COC is approaching their system building. You may be able to share expertise or considerations about how FCS is structured so that when COCs are looking to improve their coordinated entry processes, they can keep these things in mind. Another way for FCS and coordinated entry systems to collaborate is around case conferencing, or a COC's efforts around ending homelessness among specific subpopulations. So for example, some COCs have very targeted efforts around ending chronic homelessness that happen within their larger efforts. Also, just a quick note, when we say the term case conferencing, it's a term that the housing world actually has borrowed from the clinical social work field. So I do want to clarify what it means in the housing world. In the housing world, case conferencing really means bringing system partners together to secure housing and supportive service options for clients on a by name list or clients who are in a priority population. And usually the priority populations are populations such as youth experiencing homelessness, people experiencing chronic homelessness, veterans experiencing homelessness, those are often where you see some special efforts underway. It does not mean having at-length sessions to delve into the clinical aspects of maybe 1 to 2 clients per meeting, as it might mean in a more clinical setting. In these meetings, it's often cases, maybe between 10 to 20 cases are reviewed in a meeting rather than 1 to 2 in-depth cases. In some communities, what we see FCS type staff becoming a mainstay at case conference meetings so that housing navigation, supported employment, and stabilization services can be coordinated and deduplicated among all the various stakeholders who are all serving this same population. Typically, we've seen best practice be where an FCS type agency assigns a clear point of contact of who will attend all these meetings, and that person acts as a liaison between the coordinated entry system and the FCS staff at that agency. Also, keep in mind that another way FCS and coordinated entry systems can collaborate is around training, skill, and capacity building. Some COCs are really bolstering their capacity building efforts to ensure that staff across the system understand best practice in working with vulnerable populations, using the housing first philosophy, and securing essential stabilization or community-based supports to promote healthy tenancies. FCS staff can benefit from these trainings or efforts, but also they can play a role in providing training or capacity building to system staff on how to access the critical supports that you provide. So as promised earlier, here's the slide of FCS resources that give you information on FCS eligibility criteria, referral processes, all that kind of thing. So with that, that is the planned presentation. So we can now move to questions that people have, and I think Kate is going to moderate that.
Thank you so much, Ashley, for all of this fantastic information. We have a number of questions, and if folks have questions, please type them into the question box now, and we'll try to get to them before we run out of time. The first question, are Section 8 and VASH housing vouchers accessed through coordinated entry? Ashley, could you also describe what Section 8 and VASH vouchers are?
Sure, that's a great question. So Section 8 vouchers, they are funded through HUD, but they are not funded through HUD's homeless programs or resources that are dedicated towards the homeless population. They are funded through HUD's public housing branch of things. So Section 8 vouchers go to typically housing authorities to administer, and the resources that housing authorities administer are typically not included in a coordinated entry system. They are not mandated to be included. Now, what we're seeing in some places, many places, are that the housing authorities are collaborating with coordinated entry systems, and they are voluntarily including Section 8 vouchers in the coordinated entry system. Sometimes what they'll do is they'll do a homeless set aside of Section 8 vouchers, and that will be included in a coordinated entry system. But unless a PHA elects to, unless a housing authority, which are sometimes called PHAs, elects to do that, then the Section 8 vouchers would not be included in a coordinated entry system. So it's totally voluntary. And just so we're all on the same page, Section 8 vouchers are mobile vouchers or rental assistance, where someone's rent is calculated at about 30 to 40% of their income. So the rent is always affordable, and it adjusts with someone's income, and they are looking in the private market to use that voucher with private landlords. So again, it's really up to the housing authority in that area. For VASH, the answer is almost the same, but slightly different. For VASH, that is, you can think of it as a supportive housing program that is specifically for veterans. So it acts like PSH, or permanent supportive housing. It can be mobile, so like a voucher, as just like Section 8 vouchers, or it can be project-based, so the units can be in a building. The rent is, again, calculated at about 30 to 40% of someone's income, and the supportive services last forever, just like they do in permanent supportive housing, and they are provided by staff housed at VA medical centers. And VASH is usually prioritized for veterans, often chronically homeless veterans, or those who score highest on a special VASH assessment tool, vulnerability index, that the VA uses. With VASH, so there is a notice. We could send out the link afterwards if you're interested, but the VA did put out a notice saying that VA medical centers do need to collaborate with their local coordinated entry systems, and the VA said that in that notice that VA medical centers do need to dedicate some resources to a local coordinated entry system, and so that does include VASH. But the catch there is that the VA medical centers do have discretion over which resources are dedicated to coordinated entry and how much. So, for example, a VA medical center could say, we dedicate 0 VASH vouchers to the coordinated entry system. So the answer is it depends on what the VA medical center was able to dedicate at that time.
Thank you, Ashley. We have another question. What advice do you have for coordinated entry systems who want to start to coordinate with FCS and are trying to figure out what their first step should be?
So the way we've seen this play out in other communities is kind of from 2 directions. So sometimes the first step happens, it's kind of 2 steps simultaneously, one on the client level piece and one at the systems level piece. So on the client level piece, what we see are FCS staff are type staff are invited to join case conferencing among, if there is case conferencing in that COC or in that coordinated entry system about a population that really would overlap with the FCS eligibility. And the reason for that is because a lot is learned about the 2 systems during case conferencing that then can be floated up to system administrators to figure out how to streamline. So often we see that's where some of these relationships really start, and that begins the first step. But at the same time, what we see on a systems level is places really starting to meet to figure out data sharing and what data could they share, even again if it's just 1 or 2 fields, even if it's aggregate to start, but what data could they share to start really prioritizing how to coordinate who is referred to FCS, or how to increase referrals to FCS, or how FCS can start to prioritize who they do assessments on, things like that. So sometimes we see it start 2-pronged in both of those areas. The case conferencing can actually help a lot in terms of figuring out how to clean up some of the kinks that the 2 parties might be experiencing.
Thank you. Another question from an FCS provider who is new to coordinated entry. What advice do you have for a new provider to learn about how to navigate their local coordinated entry system and build relationships?
Sure. So typically, so I know I said all coordinated entry systems have variation and are different from each other. One common thing you'll find across all of them is there's usually what's called a coordinated entry lead entity. And what this entity is, they may not be the same entity that are the access points. So for example, we gave you a link of where access points to the system are located by county. They may be an entity that runs an access point. It might be a different entity, and that there's variation with. But each coordinated entry system often has a coordinated entry lead that is really driving the design of the policies and procedures and how those are being implemented. If you can't find who that is, often it is housed within or very closely affiliated with the Continuum of Care or COC lead organization. So if I were an FCS provider and I were new, I would go, if I didn't know who the coordinated entry lead entity was, I would go to the COC lead entity. So often that is the county or sometimes a city department. Sometimes it's a nonprofit, but I would go to that entity and figure out who I would talk to learn more about coordinated entry. One thing you should know is that one of HUD's requirements when they mandated coordinated entry was that coordinated entry systems have some sort of training curriculum on how their system is accessed and how the assessment process works. And so one place to start with conversations is to figure out could you have access or could they do a rundown of that training with you. And some might say, no, that training is too detailed, but we can give you an abbreviated version. Some might really welcome it because they may need more staffing capacity to actually help with assessments or help people get to assessments, things like that. But that's where I would start is either the coordinated entry lead, or if you can't find who that is, then ask the COC lead.
Thank you. We have another question. Do you know of any local COCs in Washington that are already integrating foundational community supports with coordinated entry? I can start with that, and Ashley, if you have anything to add, feel free to jump in. I have it, my experience is that every single coordinated entry system in Washington state is thinking about this very question. How can coordinated entry systems make sure that people who are applying for housing services are connected with foundational community support services? And how can those systems make sure that people who are receiving foundational community support systems or services can also access coordinated entry to access housing resources? There are 4 counties in Washington who have done especially a lot of thinking about this, and I think are maybe the furthest along and thinking about this and figuring it out. And those are Whatcom County, Spokane County, Grays Harbor, and Cowlitz. And I've just had an opportunity to interact with some of the staff who administer those coordinated entry systems, and they've just been doing a lot of thinking and implementing different strategies to make sure those connections are made. Ashley, do you have anything to add, or do you have any national examples of comparable services to foundational community supports that coordinated entry systems are integrating with?
Yeah, so in the Boston COC, it's taken a few years, but they have a very similar benefit to what FCS is. And what you'll see there is that they are doing a few things to really promote this integration of the two systems. So one thing they do these surge events where the FCS type event and type of staff and the coordinated entry staff figure out who's at the top of the coordinated entry queue for housing resources that are going to open up, and then they target those clients to make sure that they have their Medicaid health enrollment all in shape so that they can actually sign up for the FCS type benefit. Then they get people signed up for the FCS type benefit, and then sometimes it's the FCS staff who are taking over the housing navigation because there aren't other staff that are funded to actually do that work in that COC. So that's one example. They're also, again, they're using data matches to figure out where that population overlap is. They also have, there are 2 large agencies that administer this FCS type benefit in that COC. And so they have 2 somewhat high-level program directors coming from those agencies to the case conferencing for their initiative to end chronic homelessness, so that they can actually coordinate service provision on a case-by-case basis, as well as this kind of system-level work they're doing. And then what the COC is actually providing in return is they are now starting to do capacity building around how to access non-coordinated entry housing resources. And they've offered that capacity building to the FCS type staff that they have there, so that those staff can help their clients navigate other systems of care that have housing units as well. So that's one example. And they've kind of done a few of the examples we've talked about in the presentation.
Thanks, Ashley. We have one final question. Can foundational community supports reimburse a provider to support somebody going through and applying to coordinated entry? And I can start with the response. And the answer is yes. Many of the services and supports that a provider, whether it's an external provider or a coordinated entry provider, would deliver to help somebody, especially someone with really high needs, apply to coordinated entry, navigate through coordinated entry, and apply to housing. Many of those are reimbursable foundational community supports pre-tenancy services, and that link to the provider manual has a detailed description of the entire service package. So I think there's a lot of incentives for coordinated entry systems to figure out how to coordinate with FCS, especially since coordinated entry is an unfunded mandate. Just a reminder that somebody has to be enrolled and authorized for services by a AmeriGroup before a provider can start getting paid for services. Ashley, do you have anything to add to that, or any closing remarks before we end the webinar?
No, thank you everyone for attending and for your thoughtful questions.
Great, thank you so much. We'll send the recording and the slide deck to everyone who's registered very soon. Take care.